Hello, everyone, and good morning. My name is Daryl Gordon, and I'm Vice President of Marketing in San Diego. And thank you for joining us today. So this is the seventh in our series for 2021. And if you've joined us before, you know there's not a lot of formalities. We love to dive straight in and get into some of the great content. For the Q&A session, please use the chat function at the bottom of Zoom. Today's session is called Mental Health Can Be Influenced by Your Diet. And our presenter today is Dr. Tyler Amell. He's the Chief Health and Strategy Officer at MediKeeper. And Tyler is going to be making two big announcements. First of all, he's going to introduce a return guest to our series. Great to have you back again. Plus, I believe we have a big announcement coming up as well, Dr. Tyler. So I'm looking forward to hearing today's presentation.
Thank you very much, Daryl. Good morning, everyone. We appreciate the time that you've taken out of your busy schedules to join us here today. This is our second topic dealing with diet, nutrition, obesity, everything in that realm of well-being. So we're quite excited for this one. And of course, I'm very happy to have Dr. Pula back with us. She joined us back in July, and this is our first return guest. So this is absolutely wonderful from my perspective. You want to say good morning, Jamie?
Good morning, everyone.
So as is customary, affiliations and disclosures, as Daryl mentioned, I'm the Chief Health and Strategy Officer at MediKeeper. I also have a board appointment and adjunct faculty at Pacific Coast University for Workplace Health Sciences, which is one of the only universities focused on workplace health. I also sit on the executive board of the National Wellness Institute and the Work Wellness Institute. And Dr. Pula is from Avedon Health. She's the Vice President of Clinical Operations. She's a registered dietitian, nutritionist, and she also does some work in cardiac rehab and exercise physiology, which is absolutely wonderful to hear, particularly as we dive into this topic of brain health, mental health, and the relationship with diet. Now, this is very much a foundational session. As we walk through today's session, you'll learn why it is that we're presenting some of this material here today, because it very much is a springboard for some future learning events. In terms of where we came from, where we're going, you may recall back in July when Dr. Pula was here, we talked about obesity through the lens of the pandemic and how having 24/7 access to your fridge, if you're fortunate enough to be working remotely, probably didn't pan out, and COVID-15 or COVID-20 is a issue for a lot of folks out there. We spoke on musculoskeletal health and well-being, always an important topic for employers and brokers and health systems, primary driver of work disability, both costs and disability durations. And then of course today is brain health, mental health, and diet. And as Daryl alluded to at the end of today's sessions, we'll talk about a surprise guest for our October 5th session. Now, with that being said, we do have some non-MediKeeper webinars coming up. I'll be speaking at the Art and Science of Health Promotion, which is an IFEBP event. That's the International Foundation of Employee Benefit Plans. It was scheduled to be in Hilton Head, South Carolina. As of this morning, it has pivoted to a virtual event. So we're not going to be congregating in person there. Hopefully we'll get together in San Diego in April of 2022. My topic is on changes in health risk during the pandemic, and of course, what that means for the future of workplace wellness strategies. That session is on September 30th. Dr. Pula is speaking at Hero, again, was supposed to be in Austin. Due to the pandemic, it's pivoted to a virtual platform. She'll be speaking on activating hope, which is going to be a very interesting one. And then finally, at least in the near term here, is another IFEBP event. So this is the annual conference, and I'll be speaking on genetic markers for chronic diseases and what we've learned recently in that sense. So that gives you an idea of what's coming up. Now, in terms of today's topic, we've got a lot of very interesting things to cover off on. As I said before, it's very much foundational. As an epidemiologist, I love to cover the data and why this is important for employers, for brokers, for health systems, health plans, insurers, pretty much anybody with a stake in employee health. These sort of light the fire under people from a variety of different perspectives. Now, if we look at the global cost and impact of brain health conditions or mental health conditions, really we're focusing in on, for the most part, stress, anxiety, and depression. We're looking at around a 2.5 trillion, so that's trillion with a T, yearly annual spend globally. And now this has also been growing significantly prior to the pandemic. It's been accelerating through the pandemic and is expected to hit around $6 trillion by 2030. So that's an absolutely massive number. Interestingly, if you look at the GDP for the US, we're sitting at around $21 trillion total gross domestic product. So if this was the US and we were looking at it through that lens, this would be about 11% of the entire US economy. So these are very big numbers. And of course, most employers really know that there is significant impact, but health is health. And it's hard for some people to get around differentiating brain health, mental health, and physical health, and so on and so forth. So, part of my mantra these days is talking about holistic health from a strategic sense, right? And sure, you're going to have solutions that are partitioned out, focused on brain and focused on physical, but at the end of the day, you have to have a uniform and a strategic threaded strategy. In terms of impact on the U.S. economy, workplace stressors cost the U.S. around $180 billion a year, U.S. employers, and unfortunately over 120,000 lives annually. So those of you who were here early, you may have heard Dr. Pula and I speak about Suicide Awareness Day and the focus that in the month of September. So we're alluding to some of those. Now all is not lost. There's some good quality research around investing in prevention and treatment for anxiety and depression, because when we look at the return on investment or ROI, we're seeing about a $4 return for every $1 invested, which is one of the highest ROIs you can possibly imagine when it comes to workplace health and productivity. So again, there are some good quality data there. Now, from a pure depression perspective, the U.S. is looking at around $210 billion on an annual spend, about 150% increase since the year 2000. Now, as I said before, that acceleration is increasing. So we're seeing this growth year over year, more people being impacted by these types of conditions, and that number is getting quite big, quite large, or getting quite big quite quickly. Now, when we look at the cost associated, at least from an employer or benefit spend perspective, it's not all focused on assessment and treatment, but 50% of it is actually tied to absenteeism and presenteeism estimates. So you can see that there's very much a holistic sense that needs to be adopted whenever you're looking at these types of issues. Now, no surprise to anyone, antidepressant use has increased dramatically in the past little while. The number is around 3,000% from 1991 to 2018, which isn't a surprise to any employer or plan administrator these days. We know that whenever you look at the benefit spend from a pharmaceutical perspective, your antidepressants, your anxiolytic drugs, so the anti-anxiety medications are going to be near the top of the list, if not the top of the list. They may not necessarily be the most expensive single entities. Those tend to be the biologics, but the lower cost on the brain health drugs are more than made up for by the sheer volume of people that are taking these drugs for a variety of reasons. Now, the cost of lost productivity and employment from depression is approximately 23 times higher than the cost of treating. So this underscores that strong relationship and that high ROI. So if you're able to actually work through a disability prevention lens and drive down those elements, focus in on prevention, risk reduction strategies, you can actually get some substantial returns. Now, brain health issues make up around 1/3 or 33% of short-term disability and long-term disability claims, but over 70% of work disability costs. And this is primarily due to the comorbidities or polymorbidities. So that's having two conditions at the same time or more than two conditions. So usually if you're going to end up with anxiety or depression, it's usually not going to be a standalone issue from a health perspective. There's probably going to be a back pain, arm pain, cardiac disease, type 2 diabetes comes to mind. So speaking of diabetes, we're going to shift gears a little bit and talk about the second element of today's topic, and that's beyond the mental health aspect into the obesity side of things. So these are data from a very recent study published in the Journal of the Occupational and Environmental Medicine. Obesity rates absenteeism by about 3 days per year. Now, of course, this is pre-pandemic research. Absenteeism rates now, it's kind of hard. It's like nailing Jell-O to the wall these days when you've got 80 to 100 million people working remotely. Those types of metrics are difficult to use. Now, they can still work most definitely for frontline workers, obviously essential workers who haven't really had a change in their places of employment during the pandemic. But it does goes to show that there is a strong relationship between health and productivity and obesity to the tune of approximately $540 per year. Now, whenever you roll up these data, we're sitting at around a $27 billion impact to US-based employers on an annualized basis as a result of obesity. Which brings us to this topic of food as medicine. There was a study that was started back in 1944 that looked at caloric restriction in a group of volunteers. So basically moving them towards a calorie restricted diet to see what sort of implications that had for their physical health as well as their mental health. And it turns out that in that particular study, it was a Minnesota starvation study, that they were actually able to elicit depression in individuals. So there's not that much of a stretch to go from people who are on a calorie restricted diet to being more at risk for depression and in fact exhibit symptoms of depression, to thinking that, well, maybe the things that we eat actually can impact our brain health to a significant degree. Now, this point really came home to me on a personal level, probably 6 years ago or so. I was meeting with an indigenous group, an indigenous health group. Type 2 diabetes, as many of you may know, significantly impacts the indigenous populations. You know, it's up there with their top list of health concerns for a variety of reasons. And I happened to be sitting across from one of the elders, and you know, he was listening to what it is that we were saying, because we were trying to work on health promotion initiatives within the community. And he stopped me at one point and he said, every time you guys come here, all you want to do is get me to eat more pills. And I thought to myself, I'm like, yeah, you're right. And he's like, no, all I'm doing is eating pills. I'm eating white pills. I'm eating yellow pills. I'm eating all these pills. Usually when you think about pharmaceuticals or orally administering a medication, you say you take naproxen or take ibuprofen or you take acetaminophen for a headache. You know, you don't say I ate some drugs for my headache, right? You don't tend to see
So
that.
true. So true.
Absolutely. But in reality, your body doesn't know the difference. You know, you're ingesting chemicals, and the chemicals that make up the drugs and those compounds and the pharmaceuticals, they're designed a specific way to elicit a certain pharmacological effect, and that's what they do. But the foods that you eat are the exact same thing. They're all made up of chemical compounds. They're mostly natural, except if you're eating artificial types of foods, which Jaime will get into as we get into that. But you know, his perception was bang on, and it took me a while to realize that, you know, in some people's eyes, you know, they don't differentiate between you know, the medications coming into their body orally and this sort of thing. So that really got me thinking that perhaps there's something there around, well, how can we shift this mindset? How is there a relationship? First of all, what does the research say about diet? And you know, we're focusing in on brain health because this is a very important topic today. You know, can it be changed? Can your risk of post-traumatic stress be decreased? Can your risk of stress, being impacted by stress, anxiety, depression, can it be changed via diet? And how important is that relationship? So with that being said, I'm going to turn it over to Dr. Pula now, and she's going to talk a little bit about this quote from Hippocrates, who is the person behind the Hippocratic Oath, for those of you in the healthcare community, of let food be thy medicine and let medicine be thy food. Now, there is a little bit of controversy over whether or not he actually said it. Either way, the quote's been around for 100 years. It's a good quote. I like it. And over to you, Dr. Pula.
Thank you so much for that. So rich intro and all those numbers. I'm still just wrapping my head around them. But yes, Hippocrates is known as the father of medicine. He was a Greek physician, and we'll just take those wise words as well as your talks with the elders. So it makes sense to touch base on the three epidemics, which are the obesity epidemic, the substance use disorder epidemic, and the mental health epidemic within the pandemic because of the relevancy during these challenging times. So regarding obesity, our geographical location matters, and depending on where we're living, our community can be experiencing up to 42.4% of the population who is overweight or obese. That's more than 100 million people 18 years or older. And if you've been following this MediKeeper series, we've been doing a lot of talking about those risks associated with obesity as a comorbidity or polymorbidity, as Dr. Amell pointed out, for a majority of these COVID-related hospitalizations and deaths. So not a small topic to touch on. Regarding the substance use disorder epidemic, 61.2 million Americans have been touched by mental illness, and that's the statistics from 2020. And there's been an increase of nearly 6% over 2018. That's probably most likely driven to just being properly diagnosed. But keep in mind that this does not account for all the loved ones that are negatively impacted by those diseases of chronic despair and addiction. Regarding mental health, with all the current events and challenges, it doesn't come as a surprise that there's an uptick in the reporting of these symptoms associated with anxiety and depression. If we look back in 2019, only 1 in 10 adults reported these struggles. Then in 2020, 4 in 10 adults came forth with experiencing struggles. So what will the reporting look like at the end of this year or in 2022? What's that going to reveal? And worth mentioning, this data does not capture those signs and symptoms that are reported by our youth, who we understand are greatly suffering from these adverse childhood events right now. So here we are, still plugging away while facing natural disasters, children and adolescent safety concerns at schools, overdose and fentanyl poisoning awareness. We have elder suicide that's being highlighted, and this pandemic. And so now is really the time to start to highlight what we already know about the diet and the intake and how it can influence our mental health. So we've all heard the concept of farm to table, and what a great way to support local farmers while gaining our daily doses of essential vitamins and minerals. And I'm a big proponent of eating whole foods naturally. We do know that it's not always possible, and there are those that enjoy supplementation, but we're not going to dive into that too much right now. But what we can say is that researchers suggest that foods like produce, like fruits and veggies, and grains that are grown in our farms, they boost our immunity because they're loaded with all these important nutrients. So here we have it, food as medicine, or pharmacy with an F. So by means of background, there's a little Nutrition 101. I know everybody loves to talk about nutrition, at least I do. I'm going to try to make this brief, but I do want to give us a little bit of background. So foods are composed of nutrients, which are used in the body to perform vital tasks. There are basic types of nutrients. One category is macronutrients or macros, and they include carbohydrates, proteins, and fats. And they share one big function, and that is to provide us lots of energy to perform work and play, if we allow so. But in food, the energy is measured in calories. And just like your car burns gasoline or electric to drive around town, or your body, burns carbs, proteins, and fats to walk, cook dinner, and play in the park, that's the main focus of them. But the other category that we want to highlight and start to dive into today is a category called micronutrients or micros. And this includes vitamins, minerals, and omega-3 fatty acids. And they're divided into water-soluble varieties or fat-soluble ones. So the water-soluble vitamins are the vitamins like B vitamins, vitamin C, K, and the fat-soluble ones are like A, D, and E. And water-soluble ones are just like they sound, they dissolve in water. And fat-soluble, they're stored underneath our skin. And actually, if we take them, whether we eat them as foods or we take them as supplements, they're best absorbed with fats. So the micronutrients, the minerals or elements. So think about the periodic table. I'm going to bring you back to high school now. Some examples include iron, which is needed to carry the oxygen in our red blood cells, as well as calcium. And these are important for our bones and our teeth and our heart even. So regardless of how we can just keep going into this, micronutrients, they play such a crucial role. They involve neurotransmitters, hormones, enzymes, and they even protect us against free radicals. So as you can tell, they're not little, they're not micro in any way, but they don't provide energy. That's what I just want to point out now. They assist in getting all that energy released. So I can just go on and on about this, Dr. Amell. You're going to have to stop me. We're going to shift gears a little bit.
I can tell you're passionate, but let's get back to brain health and nutrition.
So we'll shift gears specifically towards the micros found commonly in our pharmacies. And basically, this is our first arm of defense against how to protect our bodies and our minds. And that's whether we're talking about natural or man-made disasters. In fact, in a recent meta-analysis published this year in the journal International Perspectives in Psychology by Dr. Ruckledge and her colleagues, they found that micros may reduce the risk of post-traumatic stress disorder from 75% to as low as 17% for those people who survived earthquakes, floods, and even terrorism. So earthquakes, floods, and massacres, what do these three have in common? Well, for beginners, we can agree they're all disasters, even if two of them are natural made and the latter is man-made. We also know that there are several factors here, though, that are relevant. And they include, first of all, in all incidences of disasters, there's typically a lack of access to a diminished supply of high quality food, especially at the onset, like we all witnessed and unfortunately experienced at the beginning of this pandemic. Secondly, there's usually this overindulgence of comfort foods, regardless of access to high quality foods, because, well, it feels good to eat some foods over others, especially when we're facing times of chaos and despair. And thirdly, we also know from the review of literature that the way each one of our bodies we handle these essential micronutrients, well, it varies. And so, we touched this concept last time when I was a guest in July with Dr. Mel, I think your favorite title ever, COVID-19 and obesity, what's lifestyle have to do with it? But researchers like Doctors Ruckledge and Kaplan, as well as their colleagues, they've made lifelong careers out of studying these dynamics immediately following the aftermath of catastrophic events. They apply methodology to clinical nutrition and mental health sciences to examine trends and health benefits for those people who'd survived these events and how their mental health status is associated with them. So the figure, if you could just go back for 1 second, um, we're looking at an illustration of the reanalysis of the randomized control trial data that offers a comparison of similar findings across three of these catastrophic events in culturally diverse populations within developed countries, namely Canada and New Zealand. And we found striking results, and they're all similar. For clarity, the flood that was studied, depicted in the middle, happened in Calgary, Canada in 2013, and both the earthquake on the left and the mass shootings in the mosques in 2019 on the right happened in New Zealand. And when we compare usual treatment, B vitamins, vitamin D, and other micronutrients, the researchers discovered that survivors who are already taking supplementation or who were provided with micronutrients as a clinical nutrition service right at the onset reduced psychological distressors to a significantly clinical degree immediately, 4 to 6 to 8 weeks, and again at that 1 year follow-up. So what did we learn from these studies? What can we apply? We learned how to better triage and apply things, reputable and replicable health interventions to those that are high nutrition risk and high mental health risk during the pandemic, as well as these other three epidemics that we just highlighted. Next slide, please. So let's shift our focus on an article that was published in JAMA in September of 2019. This was just a little over 6 months into the pandemic, and it was titled Trends in Dietary Carbohydrates, Proteins, and Fat Intake and Dietary Quality Among U.S. Americans, 1999 to 2016. The researchers of this cross-sectional study of about 44,000 American adults used a 24-hour diet recall, and this was based on 9 national health and nutrition exam surveys, and they found favorable results. As a whole, we reduced our low quality carb intake, like added sugars. We increased our high quality carb intake and plant-based foods like whole grains and nuts, and we were able to increase our polyunsaturated fats. But the researchers suggest that we've still got some work to do, and unfavorable results include that 42% of our energy intake still comes from that added sugar, and that more than 10% comes from saturated fat. So what's the significance? Well, here, remember, this is highly reputable data, comes from 9 nutrition surveys across 17 years. Throw in the pandemic, and the ultra processed food consumption goes up. Next slide, please. So we're going to look at some organs, and what did these 3 organs have in common? No matter what chronic condition we're talking about or focusing on, like you said, Dr. Amell, we can tie 3 target organs back to the 3 epidemics within the pandemic, and they are the brain, the heart, and the kidneys. And these 3 vital organs, in addition to others, play an intricate role in managing the obesity epidemic, substance use disorder epidemic, and the mental health epidemic. Next slide, please. So again, we're echoing on previous messaging across this webinar series. There are some things we cannot change. We can't change our family history, our age, or gender, but there are many behavior changes we can focus on to better address these chronic health conditions. And that does include suicide prevention, which, by the way, remember, we're honoring this month of September. We know from the literature that diabetes and heart disease both affect the major target organs. And those, again, are the heart, the kidneys, and the brain. But we also need to bring to light that our communities, we're struggling with mental health, and we're still focusing on those same 3 target organs. You'll see that that's highlighted in the red is also the gut. It's the microbiome, also known as the first brain. It's heavily related to the mind, body, spirit connection. And furthermore, if you look, any type of healthy lifestyle approach that we are going to implement is going to focus on the same types of remedies, including medicine. We can't always get away from medicine. That's okay. We're not here to. We're just here to supplement with great advice. But that has to be fueled by proper nutrition, social support, and physical activity. Next slide, please. So enough chatting. Let's take some action, and let's talk about some healthy tactics that we can begin. So here are 3 top healthy brain food tips for more clarity, better focus, and rejuvenating energy. You can get your iPhones out or snap a picture of this slide so you can set your automated calendar reminders and just choose one. The first one being drink enough water throughout the day. Start as early as possible. Dr. Amell, I know you have your water bottle. Let's role model. The second tip is to focus on how, I love it, how to and when to breathe, right? Don't forget breathing. You have to breathe, and that reduces your stress immediately. So think about this. The air that we breathe, the water that we have to drink. And then the third tip, eat more fiber-rich foods. And that's because not only are they loaded with those microbes, but they're also loaded with fiber, okay? Fiber is a type of carbohydrate that cannot be broken down in the GI, and it doesn't give energy. Most of us know it has a role in getting rid of waste, but it also is highlighted in its action as food for human microflora. So that microbiome that we just talked about, it contains live microorganisms. And recall how we just went over, that's the secondary target organ. The gut, or the first brain, is vital role in stabilizing mental health. And there's how mental health can be influenced by your diet.
Excellent. Thank you, Dr. Pula. Really appreciate it. I tried to find an image that sort of summed everything up, and you would think that this macaroon could be a hamburger depending on the coloration there.
Looks like artificial coloring to me. Good job.
Sure does. Excellent. Well, thank you very much. Very insightful. One thing we did want to circle back on, something that we mentioned at the start, is that we feel as though that there's something quite meaningful and important here. So we have actually invited Dr. Bonnie Kaplan, who's a colleague of mine, to come to our session on October 5th. She actually published a book with her co-author, who is one of the people behind the research that Dr. Pula was mentioning around the impact of, yes, there we go, natural disasters, post-traumatic stress, and really divulging and dissecting the relationship between brain health and mental health. So in this particular book, Overcoming Anxiety, Combat Depression, Reducing ADHD, and Stress with Nutrition, published earlier this year. So Dr. Kaplan is going to take some time out of her busy schedule and join us on October 5th. And one of the questions that I've posed to her is, how can wellness programs and the benefit plans that they support help reduce the need for pharmaceuticals with proper nutrition? So this is targeted at pharmaceutical benefit spend from a plan design, plan administration perspective. And nutrition probably doesn't get its deserved attention for the most part whenever people are designing these types of initiatives. It's always thought of as a pillar and something that people should be looking at, but it tends to be overshadowed. Now, when you link brain health and diet, nutrition, and because mental health is such an important factor that every employer is tackling with these days, you sort of end up with getting 2 birds with 1 stone. And then, as Dr. Pula pointed out, you layer in the diabetes and the heart disease risk. You can see how this is a very compelling strategy that you can use to help improve the overall health and productivity of your people. So with that being said, we are at time. Daryl, I don't think we have any time for questions today, but if there are any questions, feel free to send them in to Daryl, and Dr. Pula and I would be more than happy to answer them. Over to you, Daryl.
Thank you. Well, I suspect, Dr. Tyler and Dr. Pula, that this could have been a 1-hour webinar, and we quite easily still would have just been scratching the surface. But your commentary is so valuable, and I do appreciate everyone's time. So if you have any questions and you've submitted to them, we will get back to you with them with answers. And if you've missed any of the sessions to date, you can find all of them on the MediKeeper website. You can download and still view them. Thank you for your time today. Thank you to our presenters. Thanks for our guests. Have a great day, everyone. Be safe.
Thank you. Bye-bye.
Bye.